Welcome to today's Google Hangout with Executive Director of the Preeclampsia Foundation, Eleni Sigis. One of the common things that we hear at the Preeclampsia Foundation is the phrase, preeclampsia ends with delivery. Unfortunately, preeclampsia can happen postpartum, so today we're going to be talking a little bit about postpartum symptoms that pregnant women should watch out for and what to do if those symptoms manifest. Eleni, can you tell us about why preeclampsia is still a concern after delivery?
Absolutely, Lainey. Thanks so much. This is a really important topic as we're learning more and more actually across the country, because we're starting to do more intensive evaluations of maternal mortality cases, situations where moms have died. And one of the things we're realizing is that over 80% of the maternal deaths happen after the baby's been born. So postpartum preeclampsia is definitely a concern. So let me just start first of all by thanking Pregnancy Magazine for organizing this Google Hangout. I think these are a lot of fun and a good way to get some information across about really important topics. So postpartum preeclampsia, I think one of the most great illustrations, I guess, that I've ever heard about this is preeclampsia is like a train, a freight train running down a track. And it's big and it's heavy and it's built up a lot of steam. And when the engineer goes and grabs the brake and pulls the brake, the train does not come to an immediate stop. And it's like that with delivery. So delivery does halt that forward momentum of preeclampsia, but it's not gone. And depending on how far that woman has gotten into that disease process, it may actually get worse before it gets better. The other thing is, in that postpartum period, people are all about the baby, and moms deliver the baby, and she's dealing with sleep deprivation, and if it's her first baby, she doesn't know how her body should be resolving after delivery, and everybody's oohing and eyeing over the baby, and no one's paying attention to the fact that mom's over there gasping for breath or having headaches, or any number of these other sort of typical preeclampsia symptoms, all of which are just as important after delivery as they are during pregnancy. So just a quick rundown again of some of the typical preeclampsia symptoms. You've got sudden weight gain, you've got headaches, visual disturbances, nausea or vomiting, of course hypertension, which is not necessarily something a woman's going to feel, but if she does take her blood pressure and it's up, that's a concern. There may be liver damage that's still happening, so pain in the upper right belly, and probably one of the most significant symptoms after delivery is difficulty breathing, because it's at that point that pulmonary edema, basically fluid in the lungs, might have set in as a result of the preeclampsia, and that's very, very dangerous. So those are some of the symptoms that a woman who has already delivered, whether she was diagnosed with preeclampsia during pregnancy or is not diagnosed until after, those symptoms need to be paid attention to, which includes, if she's sent home with discharge instructions, that list of symptoms really needs to be on those discharge instructions.
Definitely. So women who have postpartum preeclampsia, are they susceptible to the same risk of suffering an eclamptic seizure as women who have had preterm preeclampsia?
Absolutely. Really, the only difference in terms of the outcomes from preeclampsia is that the baby is no longer on board, so that there's two patients involved in preeclampsia, the mom and the baby. So really the only one who's out of danger is the baby. Mom is still susceptible to seizures, which is what's called eclampsia, or further organ failure, hemorrhaging, as I mentioned, pulmonary edema. There's stroke, that's another very common thing, and a lot of those are driven by uncontrolled high blood pressure, which can absolutely persist after delivery.
What would most healthcare providers recommend women do if they manifest any of these symptoms?
Well, if she's still in the hospital, she needs to alert her care providers immediately. Really, the symptoms of preeclampsia are extremely dangerous, and if she's having them after delivery, she's very likely in serious health danger. If she's already been discharged and has gone home, do not wait. Get back to the hospital and go to the labor and delivery unit that you had your baby in. Do not go to ER. If you don't have a choice and the emergency room is your only option, the first thing you need to tell them is, I just had a baby. Because a woman who is immediately presenting to the ER after delivery needs to be looked at differently than some woman just walking in off the street having these symptoms.
Absolutely. Are women also susceptible to preeclampsia in future pregnancies if they have experienced it postpartum?
They are. In fact, they're at higher risk. One of the biggest risk factors for preeclampsia is that you've had it in a previous pregnancy. So that's another thing that as you go into your time after pregnancy is that you fully know and understand what happened to you in pregnancy and take that information to your next healthcare provider. You may not be seen by the same doctor, and as much as we'd love electronic medical records to come with us through every pregnancy, that doesn't always happen. So it's very important that you convey that to your healthcare providers, that you've had preeclampsia in a previous pregnancy. Or even if you just had high blood pressure in a previous pregnancy, that is also important.
So just to finalize, how long should women be monitoring for these symptoms in the postpartum period? And can you give us just a quick rundown of things that we should be watching out for postpartum?
Definitely. So the two things I would say is technically this can happen up to 6 weeks postpartum, 6 weeks after delivery of the baby. The closer you get to 6 weeks, the less likely it is to happen. To be honest, the most dangerous time is about a week after delivery because there is a natural rise in blood pressure that happens anyways. Mm-hmm. And for that reason, after delivery, and especially if you've had preeclampsia, it's a good idea to be seen by a healthcare provider 3 to 7 days after delivery just to have your blood pressure checked. In some states, this is actually being integrated as a standard of care to be seen about a week after delivery. But honestly, anytime up until about 6 weeks, if any of these symptoms present themselves, that woman needs to get to a qualified healthcare provider.
All right. Thank you, Eleni, for being with us today, and thanks to Pregnancy Magazine for spotlighting this postpartum preeclampsia chat.
Thank you.